It is now 5 o'clock, and we'll go ahead and start the Special County Health Committee. Are there any participants for the teleconference, Scott?
There are not.
Or not? Okay, we'll move along. Okay, I need a motion to bring forth our resolution for the project labor agreement for construction of a new Health and Human Services campus. Rob and Steve, thank you.
Right.
And all those in favor? No, I don't need a favor.
Would you
Never
like?
mind, let's
I'm,
talk.
I'm happy to go
Let's
straight to the vote, or
No,
I
no,
can
no, I'm
summarize for you, Madam Chair.
Let's talk. Let's
Okay.
get a presentation.
So, committee members, if you remember, we talked about this as an informational item at your regular business meeting 2 weeks ago. Just a timing issue with being able to get the actual agreement back from West Central Illinois Building and Construction Trades Council to be able to get it in your packet in time from 2 weeks ago. Just in summary, as is our past practice on all major capital projects, we seek a project labor agreement for the craft unions under West Central Illinois Building Trades and Construction Council. The agreement ensures things such as an adequate supply of labor for the various craft unions during the construction. It also has a dispute process should there be disputes on the job site during construction. It prevents and protects us from any work stoppages during construction, and it also establishes, and these are taken right out of the requests for proposals that we did for the construction manager at risk, but it formally establishes the workforce goals for both minority participation at 18% and women at 5% for the construction side of the project. If you recall from the RFP when we looked at construction managers at risk, there's also a component that deals with the subcontractors and suppliers. That is in the contract with River City Construction as they are the awarded construction manager. But for workforce, since all the subs and suppliers that will be working with River City have various craft unions, we have historically put those goals into the project labor agreement. This will be the fourth time in the last 15 years we've used this type of document for a project of this scale. Happy to answer any questions.
The workforce goals are just that, right? Goals. There's no real way to keep them accountable for that?
Correct. They are goals. But we work very hard to through reporting and to ensure that those are achieved. We exceeded those on the museum construction project. We met and just barely exceeded on the construction of Headington Oaks, and we met them on the demolition of Bellwood Nursing Home. So we have a good track record of working with the various subcontractors and suppliers and the various craft unions to ensure that we do achieve those goals. So,
Thank you.
Sharon and then Rob.
Real quick, I will be abstaining from this vote because this is my employer.
Any other questions, Steve?
Not a question, just more of a statement for the public, is that we will still bid these jobs out regardless of this agreement. Hopefully we have local contractors that win the business so we can keep the business local, but we'll follow our normal practices of bidding the jobs. Thank you.
yeah, correct. Just to add on to Mr. Ricker's comment, so bid packages for the various subcontracts and suppliers, those will be, sometime late fall, early winter is when we'll put those on the street, and those will be bids that this body will, coming through the Health Committee, will then award those contracts to, and there'll be various packages. So how we do it is we package various trades and suppliers into multiple groups, so there'll probably be 3 to 5 various bid packages you'll vote on.
Any other comments, questions? Okay. If there are no further discussions, As we know, the motion is a project labor agreement for the construction of a new health and human service campus. All those in favor, say aye. Aye. Those opposed? The motion, oh, and one abstinence. The motion is carried. Any miscellaneous? Rob?
I just wanted to let everybody know to be on the lookout for the Ombudsman bus. We just revealed it today, and it was a great time. We also got to meet Angie, who is the person that the Center for Prevention of Abuse hired with the grant that we gave them. So hopefully she'll be able to join us sometime and introduce herself.
Great, thank you. Anyone else? This meeting has been adjourned.